Hello everyone. During this short lecture, I will explain to you about what is the first-pass metabolism of enteral medications. So when we take oral medications such as tablets or capsules, now firstly, these medications has to be digested through your gastrointestinal system. So the medication needs to go through your gastric system first. And from the gastric system, the medication will then reach your liver through the hepatic portal system. Now we know that liver is a large organ which is responsible for detoxifying the blood come from your gastric system. So liver helps to filter the toxins out of your blood. Now, also, liver helps to break down the medication and metabolize the medication as well. Now, when the medication reaches the liver, some part of the medication will be metabolized and some part of the medication will be left unchanged. So during this hepatic first-pass metabolism, now biotransformation occurs where liver will produce enzymes to break down the medication, resulting in reduced amount of the medication entering the systemic circulation. So before the medication is absorbed into the bloodstream, now liver first will produce some enzymes to break down the medication. So the amount of medication will reduce before it reaches the blood. Biotransformation occurs primarily in the liver. However, some other organs, including the lungs, kidneys, blood, and small intestine, all play roles in metabolizing some medications. Bioavailability is another terminology, which means the percentage of the unchanged medication that reaches the systemic circulation for distribution. So now, if we give medications through the veins, that's your blood vessel, through the blood vessel directly into your bloodstream, so this medication will have 100% of bioavailability because it doesn't need to go through the gastric system and doesn't need to be metabolized by the liver first. But some medications are better given through the parenteral route, through the IV, or other routes, not orally. So some medications are not suitable for given orally because they are almost entirely metabolized by digestive system. So they are not suitable to be given orally. So some medications, for example, the glyceryl trinitrate, we also call it angine, now also call it GTN. Now this medication is very effective in treating chest pain. Now glyceryl trinitrate, if we give orally, it will be ineffective and it will be destroyed by the liver during the first pass metabolism. So normally we give the GTN or glyceryl trinitrate under the tongue. We call it sublingually. So when we put this glyceryl trinitrate under the tongue, the medication will be absorbed through the oral mucosa membrane into the bloodstream directly and is able to reach the target organs to take the therapeutic effect. So it doesn't need to go through the liver. Now, first pass metabolism is also the reason why oral doses and parenteral doses are not equal giving medications, while the parenteral route means that smaller doses can be given to achieve the same therapeutic effect. So given medication through the IV or the other routes instead of orally will be more suitable for some type of medications as because they will be metabolized by the liver through this first pass metabolism. So thank you for listening. I hope now this small lesson could help you to understand what is first pass metabolism. Thank you.